Well, within caucus today, no one is terribly surprised that a speech was drafted. The speculation of a leadership change was building weeks before the coup actually took place. And Julia Gillard was approached by both Bill Shorten and Greg Combet around that time. She rebuffed those urgings at the time, and those who were closely involved in the coup still insist that no final decision was taken until the very last minute. In the words of one, it was a bit like the Arab Spring. Suddenly, everyone emerged supporting the need for change. But there has been widespread criticism in the caucus today of the Prime Minister's decision to take part in that Four Corners story. She has argued that she was told this was a story about the progress of Labor since coming to office in 2007, but the reporter who did the story, Andrew Fowler, says the Prime Minister's office was told specifically that the leadership issue would be discussed in that issue. Again, it seems it goes to a question of judgment in her office. Coming up, we're going to be looking further at the fallout from this story. First, though, there's been some good news for the government today. It's now secured the support for a means test of the private health insurance rebate, something it's tried a number of times to get through Parliament. Now it's locked in the support of independents Andrew Wilkie, Rob Oakeshott and the Greens. But to win over the Greens, the government has had to give a little on dental care. It's going to kick in $165 million to dental care, something the Greens have been campaigning hard about. I'm joined now by the Greens Health spokesman, Senator Richard Di Natale. Thanks for your time.
Good afternoon.
You wanted $1 billion for dental care. You've got $165 million. Is that a good deal?
Look, we think the deal that's been announced is essentially a down payment on what needs to happen in this year's budget. We made it very clear that the scale of the investment necessary to get Medicare-funded dental care off the ground is in the order of $1 billion. We think when you look at the existing programs and some savings that can be made around those, and some new money brought in, it comes to around that figure.
So existing programs being the current chronic disease dental scheme, you're saying get rid of that and put it all into a public dental scheme?
We're saying it needs to be overhauled. There are some very good things about the scheme. It's providing Medicare-funded treatment through the private dental profession, and we're not going to get anywhere unless we involve private dentists. So we are bringing in Medicare into the private dental profession through the chronic disease scheme. That's a good thing. We need to look at whether we can means test it, whether we put some restrictions around the scope of services offered.
Which is something the Minister backed today, a means test of this chronic disease dental scheme so that it would only be available to those on less than high incomes.
Sure, and what we need to then do is look at who is the next group of people that we can bring in. Low-income earners who are desperate for treatment. You've got to remember we've got thousands of people on public waiting lists across the country. We've got people who defer treatment because they can't afford it. They're going to see their GP. I was in general practice. You'd have 1 in 10 patients coming in to see you because people just couldn't afford to go and see their dentist. So we need to remember that we've got to also bring in some new money for low-income Australians who can't afford dental care at the moment.
But have you got any assurance you're going to get this? Because all you've got today is $165 million. That's not to be sneezed at, of course. But there's no guarantee from the government on the rest of it.
Well, you're right. We think it's a great outcome to have that down payment. We think that's really important, and it will provide some important dental services for people right around the country. We are in negotiations with the Minister. I'm encouraged by the tone of those negotiations. I think she does have an appetite to make to make a significant investment in this area. It's one of the big reform challenges that faces the country. Bringing dental care under Medicare is an ambitious project, but it's a really important one, and I'm optimistic that we'll get somewhere with it.
But what about getting back to the private health insurance rebate? Now that it will not be offered to those on higher incomes, how worried are you about this exodus from private health insurance? And there are different estimates on what the impact is going to be and the impact that's going to have on premiums right across the board.
I'm not particularly concerned. It'll be far less than 1% of people who currently have private health insurance, so it's a drop in the ocean. But one thing we've got to remember is we keep talking about people who access Medicare as though they're a burden on the system, and Medicare suddenly turned into a safety net. In fact, I heard the ALP national president talk about Medicare as a safety net. It's not. It was never intended as a safety net. It's a universal scheme. Everybody's entitled to access it. The more you earn, the more you pay through your taxes, so you contribute to it already.
But it's also, if it's going to be a genuinely universal scheme, it's a very expensive scheme.
Well, this is the great myth. Medicare is in fact much cheaper than the arrangement we've got at the moment. This two-tiered model that we've created, this American path, you only have to look at what the Americans spend in terms of their healthcare budget. They've got the ultimate in two-tiered medicine, one level of healthcare for the rich, a very inadequate level for those on low incomes, costing almost twice of their GDP. They're spending almost twice of their GDP on healthcare compared to the Australian situation. No, this is the great myth. Medicare is in fact much cheaper than running a two-tiered system. The main reason for that is when you've got a single universal insurer, you've got the opportunity to limit costs in a way you can't do through the private system. So the great thing about Medicare is it's fair. Everybody gets access to good health care regardless of their circumstances, and it reduces the overall cost of health care.
Senator Richard Di Natale, we'll have to leave it there. Thanks for joining us.
Great pleasure.
After the break, we'll hear from the Coalition. They're opposed to this means test. The Shadow Minister, Peter Dutton, joins us.